At the time Palin Communications was born in the mid-1990s, it was often said that whoever controls the media wins elections, which is why the political roost was ruled by people like Rupert Murdoch in the UK and Kerry Packer here in Australia. It was Murdoch's The Sun that crowed about its determining role in the results of the 1992 UK election, with the famous headline, "It was the Sun what won it." Of course, things have changed now, and the content of the dominant social media platform, that being Facebook, is not editorial copy developed via strict news-gathering principles, but rather user-generated views and content of predominantly undetermined origin. On the assumption that, for better or for worse, most people over 16 years old have a Facebook account, it means there is now one dominant platform, and if you control that, you can just about control anything. As the recent Cambridge Analytica controversy shows, whoever controls Facebook and has access to the data and the influence inherent to the platform controls election outcomes and thereby controls the workings of democracy, if you think that through. Indeed, Facebook is at the heart of ongoing inquiries into Russian meddling in the USA 2016 elections, as brilliantly illustrated late last year on ABC TV via MediaWatch.
Hello, I'm Paul Barry. Welcome to MediaWatch. And what exactly were the Russians doing that Americans failed to see? Tonight, in a special programme, we're going to look at how Facebook and Twitter allowed their platforms to be used by Russia to swing the US presidential election and divide America.
So how might the ability to access and control Facebook data and content affect the health sector? Well, there are any number of worrying scenarios. Imagine if a specific health-focused lobby group managed to replicate the tactics described by Cambridge Analytica or by the group coordinating the pro-Trump Facebook activity described in the MediaWatch segment. Let's say an anti-vaccination group somehow managed to secure the resources required to develop bogus content, portray it as legitimate editorial news, develop universally shared vaccine-hating memes, pay for it to be presented to millions of families and convince millions, perhaps even billions of people, that the risks of vaccines are significantly higher than science has shown. And imagine if they could do that all via Facebook. The public health consequences of that would be catastrophic. And no one can really point to any restrictions or laws that would necessarily stop them from doing that. At a minor, scaled down, less sinister level, it would be safe to assume that it's probably already happening. But what happens when the total Facebook full court press gets ramped up like it was in the USA elections of 2016? We'll only have a science and common sense to help stem the tide. So the three keys to avoiding these disastrous public health and democratic scenarios, as I see them, are: first, greater control of data and analytics by Facebook; two, greater scrutiny by users of content that comes to them via social media platforms; and three, greater reliance on trusted news sources for facts, stories and analysis. Because if the emergence of social media as the predominant source of information about both public affairs and public health comes to blur verifiable fact from contrived fiction in the minds of people making decisions about governments and health options, then we're all honestly in a good heap of trouble.